And in the legislation that we just passed 2 days ago, along with the health care reform, there was an enormous expansion of the Pell Grants so that kids can go to college, so that they could get the education that they needed. For community colleges, an expansion for community college Pell Grants. Again, changing the way in which we look at employment. Employment is more than just a job. It's preparing for the next job. And in that corrections bill, sometimes called a reconciliation bill that was accompanied with the health reform, we had the program to expand the support for men and women that wanted to go back to school and men and women that were in school. We also expanded over time the ability for those men and women to pay those loans back. Presently it's 15% maximum for each year of employment when they're employed. And we're going to reduce that to 10% so that they can spend their time acquiring a home, a wife, kids, a husband, and be able to continue to pay back the loans over a longer period of time. Very, very important, but unnoticed in the health care reform. But much noticed in the health care reform was the employment for the employers, the small business tax credit for those employers that continue to provide insurance for their employees. I remember a phone call that I got from a radio station. A fellow phoned up and said, well, how does this piece of legislation, the health care reform, help me? My wife and I are a small business. We have 2 employees, my wife, myself. What's it do for me? And I was able to respond that when this bill becomes law, and it is now the law of the land, the President signed it yesterday, when it becomes law, it will do this for you. 35% of the money you spend purchasing that insurance for you and your wife will be a tax credit. You will be able to deduct that from your taxes, literally reducing the cost of the health insurance by 35%. And as you grow up to 100 employees in your business, you will continue to receive that tax credit for every insurance policy you buy for your employees. And in 2014, that tax credit goes to 50%. An incredible reduction in the cost of health insurance for small businesses all across America, and it goes into effect now, January 1st, 2010. Now that that bill has been signed, a very, very significant reduction in the cost of health insurance, allowing men, women who are in business, who have a small business, maybe it's a gardening business or a home care health business, to be able to continue to provide that insurance. On another scale, I received a press release today from a group in the San Francisco Bay Area that points out that they are in strong support of what the President does. This is 1,500 biotechnology businesses in the Bay Area that have banded together in an organization called Bay Bio. They said this is a tremendous assistance to us. Small businesses, which I just talked about, the tax credit available to them, but also there are billions of dollars in this bill for research on pharmaceuticals, biological pharmaceuticals, enormous impetus for those businesses to produce the biological pharmaceuticals, the next generation of pharmaceuticals, drugs, to help us in our health care when we become sick. All kinds of things from diabetes to cancer treatment and everything in between. The pharmaceutical industry in the biological area has an enormous push. They have 12 years to recoup their investment. It's given to them in the health care reform. So when our colleagues over here on the Republican side say there's nothing in this, well, wait a minute. I've got 1,200 businesses in the biological community in the Bay Area alone saying this is a great inducement for us to produce new biologicals that will help people with their health care. Also, in the fuel business, the same thing applies in the enormous effort that's underway to do biofuels. The incentives are built into not just the health care bill, but also into the previous American Recovery Act to push along a whole new industry that will create an enormous number of jobs throughout the nation. So the health care bill is far more than just health insurance. It's also an inducement for businesses to invest and to create new businesses and new pharmaceuticals to keep us healthy and to repair our bodies when we become ill. I want to talk just for a few moments about another aspect of the health care reform. We heard before I took the microphone here about the health care bill not being simply not true. The health reform is fully funded. It's funded in a variety of ways, but one of the most important ways is the considerable reduction in the cost of health care. I had a gentleman come into my office earlier yesterday talking about, in the health care reform bill, there's an opportunity for us to engage in keeping people healthy. A major part of that health care reform is about keeping people healthy. It's wellness. It's prevention of medical illnesses. And he was looking at this and he said, here's an opportunity for me and my colleagues to expand our business. And he talked about a company that's coming to California that will take an idea about wellness. And this is specifically for the senior citizen, and it is specifically in the legislation. Wellness for Medicare. He said, the bill allows us to change the way in which the Medicare services are provided. Instead of just fee-for-service, we can do capitation, and there's an incentive in there for us to keep people healthy. The company operates out of Florida. They're now going to come to California. They're doing 50,000 people seniors in Florida. Proven that they can reduce the cost by 20% by keeping people healthy, keeping seniors from having to go to the hospital, having to go to the emergency room. They want to import it to California. They're going to move it and ramp it up to 500,000 seniors in a wellness program. And, everything, I suppose, from the food that's being served and the meals that the seniors prepare to, I suppose, exercise and yoga and other kinds of activities. Again, emphasizing wellness rather than sickness. Nobody talks about that from our Republican colleagues, but if that 20% reduction is available, we're talking about hundreds of billions of dollars over the years ahead.